Hello, everyone. Very good morning. So I'm Dr. Meena Putturaj from the TBPPM Learning Network India chapter. The other resource person is having some internet issues, so she will join. But in the meantime, I will introduce and give the introduction to the course that we are going to start today. So we have Dr. Moana as well from the TBPPM Learning Network. She has been communicating with you through emails and WhatsApp, etc. So this particular course is an online course which is on data management and scientific writing, especially for TBPPM projects. So in our network, TBPPM Learning Network, our focus is to enhance collaboration, nurture collaboration, enable knowledge exchange, and support the stakeholders, do capacity building for different stakeholders who are engaged in TBPPM business. So that is our mandate. So as part of our vision, we are organizing this online course on data management and scientific writing. So this is a 4 months course, which means that it starts in January. This is the first online session that we're going to plan. And then it will end in April. So every month you will have some online sessions on key concepts related to qualitative data, quantitative data, either it is management or analysis, and also scientific writing. So in between the online sessions, you will have mentoring sessions as well. So this is one-on-one mentoring session that we are planning. The idea is to understand the data what you have, and also to guide you and mentor you to develop a nice manuscript from the data that you have. So that is the focus of this online course. So this is in brief. Since we'll be in touch for some more months, we need to understand and know each other better. So you will know more about our work, and we will know more about your work and your interest. So I'm very excited to see all of you today. So with this, I hand over the session to Mohana. Maybe we can have a round of introduction. Yeah, Mohana, would you like to go first?
Sure, thank you. Thank you, Meena. So I'm Mohna. I've been in touch with you people. I'm a community manager at TBPPM Learning Network. Welcome everyone. And Dr. Vani from Manipal will be heading the session. She'll be joining us in a short while. Before that, we will finish the introduction session, and the participants also can introduce themselves. So, Anirudh, you can go ahead.
If possible, can you please switch on your videos since we are a very small group? It'll be nice to see the faces. Nils, your mic is still muted.
Good morning, everyone. I am Anirudh Bishnoi. Basically from Rajasthan. I am working as a district coordinator in Rajasthan in an EPTB project. And I am working in TB since 2019, TB project. Thank you.
Do you work with the department?
Yeah.
Okay, very nice. Welcome to the program. Yeah, next, Manisha, would you like to go? Manisha, can you hear us?
Hello.
Yes, Manisha, we
Hello.
can hear you.
हेलो गुड मॉर्निंग मैम.
Good morning.
गुड मॉर्निंग मैम. मेरा नाम मनीषा प्रियदर्शनी है एंड मैं डॉक्टर स्वनी से एज अ एमएनई काम करती हूँ.
Sorry, we didn't get you. Where are you working?
इन डॉक्टर्स फॉर यू.
Okay. Which part of India?
Hello.
Yes, Manisha, it was not clear which part of India you are joining.
As a MNE.
Yemeni,
मैम मेरी
fine.
आवाज जा रही है?
Yeah. Which state?
In Bihar,
Bihar. Very nice.
Muzaffarpur. Yes.
Okay, thank you. Yes, Mr. Mukesh.
Yeah. Good morning, ma'am. Myself Mukesh Kumar. I'm cluster coordinator and looking project in Bihar PPSA from Doctors for You, ma'am.
Okay, very nice. Thank you for joining today. Anirudh finished. Yeah, Manisha, can you hear us? Manisha already introduced, I think, no? Maithili?
Yeah, good morning, Meena. Good morning, Mohana. I am Maithili from PHFI organization from Bangalore. I'm working with the tribal project CITRIC in Bihar Hills here in Karnataka. So I'm pursuing my PhD from Karnataka University, Dharwad, on nutritional aspect of tribal women. So is that okay, Meena? Can I join this session because it's your project related to your project? So after joining this, I came to know that it's about TBB project, TBPP project. If
Yeah.
okay, then otherwise I'll quit from this. So
Yeah.
I thought of learning data and scientific writing preparation.
Yeah, sure. So maybe that part is useful to you.
Yeah.
The second part of mentoring and support, it may not help much. So you can
Okay.
join us. Not a problem, Maithili, and welcome to the program.
Yes. Thank you. Thank you.
Okay, Dr. Vani is here. Hello, Dr. Vani. Can you hear us?
Hello.
Yes, Dr. Vani, we can hear you.
Yes. Good morning, everyone. I hope I am audible finally.
Yes.
Yes.
We can't
So,
hear you. Is it possible to switch on your video?
video is actually switched on. I'm actually facing some glitches with Zoom this morning, which is also why I was late. A very good morning to everyone present here. And this is Dr. Vani Lakshmi from the Prasanna School of Public Health. I am delighted to be part of this particular data intervention that we are going to have in order to enable us to get better insights of data. We have been in touch for quite some time, and the whole idea behind this initiative is to help you understand the power of data and what lessons data will tell you. We get into community, we meet people, have a lot of interactions, we try to understand their experiences, concerns. Most of the time we address their problems as well, but are our efforts impactful? So to address that question, we may collect data in the form of forms, Google forms, pink colored or yellow colored or white colored forms. We get all the information filled, but are we in a place where we can provide insights out of it? So I'm here to support TBPPM in this initiative of coming up with new lessons from data. Over to you.
Thank you, Dr. Vani. So let me formally introduce Dr. Vani. So Dr. Vani is an assistant professor at the Department of Health Technology and Informatics from Prasanna School of Public Health, Manipal Academy of Higher Education. So in collaboration with Department of Health Technology and Informatics from the Manipal University, we are organizing this online training and mentoring program for the stakeholders implementing TBPPM projects. So Dr. Vani has a huge expertise and experience in the areas of applied statistics, multivariate analysis, tool developments, data mining. So she'll be with us starting the session today. So this online session will be providing basic idea about what is data management, what is qualitative data, quantitative data, how to handle, how to manage, how to analyze these kind of data, and also how come up with scientific writing using these data sets. So that is the main objective of this training program. So I'll just orient you towards the structure of what is planned today. So first we will have a session by Dr. Vani on basics of data management. And then after that, maybe it is for some 45 minutes or so, and then we have a Q&A. And then it's really next 1 hour of the session is mainly about interacting with each other and understanding better the kind of projects you do, the kind of data you have, so that we can tailor the mentoring program accordingly and depending on your needs. So this is a plan for today. The session will end at 12 o'clock. So if you have any doubts or clarifications, anything you have, please feel free to pitch in. It's a very small group. So feel free to pitch in, drop your messages in the chat box, and we'll get back to you. Over to you, Dr. Vani.
Yeah, Dr. Meena will continue with the participants' introduction. It's been
Okay, yeah.
all of them have been introduced. We can move
Yeah.
on to next one, Neeraj.
Sure.
Neeraj Kumar, are you there?
जी good morning. Myself Neeraj Kumar. I am from Bihar. PPSA project MNE admin office. Doctors for you.
Okay. Thank you, Neeraj.
Oh, thank you.
We can move on to next one, Karan Nagpurkar.
Myself, Dr. Karan, technical support in Maharashtra.
Karan, we lost you in between. We only heard your name and your place. Hello, Karan.
Now am I audible now?
Yeah, it's very feeble.
Okay. Myself, Dr. Karan Nagpurkar, State Public Health Expert from State Technical Support in Maharashtra.
Maharashtra. Okay. So state technical unit, right? From Maharashtra?
Yes.
Okay. But still your voice is very feeble. Maybe you should come closer to the mic. Yeah, welcome to the program. Yes, Anup, can you please introduce yourself?
Good morning, everyone. My name is Anup. I'm from PPSA project, um, Bihar. I'm in working Doctors for You.
Okay, thank you. Mukesh?
Good morning, ma'am. Myself Mukesh Kumar, Doctors for You PPSA project. I'm working as a cluster coordinator and supporting in project, ma'am.
Sure. Thank you. Who else? Saurav?
Hello. Hello. Hello.
Yeah, your voice is breaking, Saurav.
Hello. Good morning, ma'am.
Good
Hello.
morning. Hello, we can hear
Good
you.
morning. Myself Saurabh Kumar. I'm currently working as a M&E executive in Doctors for You project Bihar.
Okay.
Thank
Thank
you.
you. Thank you. Yuvraj, can you please introduce yourself?
Good morning, ma'am. Myself, Yuvraj, and I am a kind of program manager for the PPSA project for Doctors for You. So I had received this link for this very informative data management part for this. So I just shared this link with my core team so that they can also learn about the data part and the kind of meetings and presentation we do have. We keep on going on regular basis so that we can get benefit and learn from each other. So I was not sure that that there can be many other participants, so that I could have invite from my other state uh, team member from UP, maybe from Maharashtra. But I'll share this link with some everyone so that everyone can get benefit from this session. Thank you so much for this invitation.
Definitely. Welcome, Yuvraj. Anybody else? Did we leave anyone? Mohana, did we leave anyone? Everybody has introduced.
Yeah, everybody is covered.
Okay. Okay, welcome once again. So without further delay, it's already going to be 10:30. So we'll start the session with Dr. Vani. Over to you, Dr. Vani.
Thank you. So, I would like to share my screen first, and one of you could kindly confirm if the screen is visible. And just give me a moment. Are my slides visible? Okay. Okay. I'm intending to put it on full screen mode. I hope that is also fine. Correct? Can I go ahead? Can I have a yes, please?
Yes, it's visible, Dr. Vani.
Okay. Because I could not see Zoom screen. Okay. So I've attempted to keep this meeting very short and crisp and sweet. So, as all of you are aware by now, we are going to have a short introduction on why this training is important and very fundamental aspects of data. So, why do you need data management training, or why is this topic relevant to us today? It is primarily because we have data everywhere around us as part of various projects that we do and different people that we meet. It could be health professionals, it could be citizens, it could be doctors. Data is going to come from multiple places. Most of the time, data will come to you in the form of a form. This image credits to Path and Doctors for You. So the study participants may fill up a form. They may enter things like how many members are there in the family, what is their age, how many adults are there, how many children are there, what are the benefits from the government they get, where is their location, do they have an Aadhaar number, okay, do they have any health conditions like diabetes, hypertension, or have they undergone surgery? We may ask them a lot of questions relating to where they live and how they live. So data is there everywhere around us. Now, the power of data is data sitting in a form, whether it is in hard copy or in a Google form, is like a treasure, like gold it is, unless you bring it out and you understand the value. So unless you learn how to do data analysis or try to understand from data, it is not very useful to have data. Okay, So data, when analyzed correctly, can help you address a research question you have, solve a problem, improve the well-being of people around you, and uplift the social cause that you stand for. Maybe you are trying to assess prevalence of TB, or you are trying to understand, let us say, how effective is an intervention. Okay, so maybe you are trying to do all of it, but you collect data, and unless you have to analyze data in order to learn about your surroundings. Now, we are not the first ones in this world to learn about data or to do data analysis and management. Several NGOs around the world, including India, I'm sure some of you would have heard of Akshay Patra. So, data is being excessively used, really used by NGOs to address problems ranging from water management conservation. See, the location is Bangalore. Okay. To understand effectiveness of policies, Akshay Patra came up with a policy relating to midday meals. It could even address issues like human trafficking. Okay. And also improve the health and efficiency of every little work that you do as part of various projects that you are part of. With AI on board, there is a lot more things that you can do with a form that you collect from people around you. So we are here in this discussion. This is just a beginning. So it will be, maybe you will not do any analysis today, but we will see, we will try to understand how you collect data. So I want all of you to talk about it. And you can also give us insights on the small projects that you are doing at your end. Small in the terms of data collection, big in the terms of impact. And I'll introduce you to some small terms relating to data. So I am sure all of you would have heard of the term statistics at some point of time. At some point of time, you would have heard about statistics. It is actually the science, the arts, the commerce, everything about how to ask the right question, how to ask the right question to people around you, how to collect data, okay, how to collect, information from people. What has to be collected? What has to be collected? How do you talk about this data to others? How do you analyze data? And how do you help people understand what you have done? So the entire process that I listed below is actually called statistics. Okay. So when we learn about statistics through Microsoft Excel, okay, we are going to definitely learn some basics of Microsoft Excel. I'm sure some of you are familiar with handling Microsoft Excel. We will just learn some tips and tricks to help you improve the way you work and improve data analysis. So we are going to use a software to help us analyze data. So sometimes we come up with beautiful graphs based on data. Sometimes we will describe data. We will tell that the average time taken for the intervention to work in Bengaluru, let's say, is 6 months. Okay. Or the average age of people living there is 64 years. Okay. We might come up with all these findings. At that point of time, we are summarizing data. It means we are describing data. Okay, that entire process is called descriptive analysis. The entire process is called descriptive analysis. Now, when we are trying to learn from data, okay, we are trying to learn something more from data that you cannot do with your eyes looking at the screen. At that point of time, we call it inferential statistics, learning something from data. If you open your phone today, be it Instagram, be it Facebook, you will find the word insight. You will also find the word AI. You will also find the word prediction. Okay. So in all these times, we are actually learning from data in order to improve the intervention you are providing, in order to improve your data collection mechanisms, in order to improve your understanding of the study population. Now, we need statistics or data analysis because our data is in this form. Okay. Our data could be in the form of a form or a record that you are collecting. Data is in this form, and you will definitely meet hundreds or thousands of people in throughout your project. So looking at data in bits and pieces like this is not enough. We need data in a very structured format in one place where if you go through the data, you should be able to understand the study population or find answers to the problem. Okay, so that is why you need data analysis techniques or statistics. Now, when we are talking about data, I have made a small table here. I hope it is visible. The table is visible, no? I'm hoping so. I will zoom it a bit. Okay. So in this study, what has happened is maybe you went for a morning walk. Okay. Maybe you went for a morning walk today and you met 7 human beings. Okay. All of them are men. Okay. You met 7 men. Okay. From a 1-year-old child to a 70-year-old man. These are the people whom you met during your morning walk. So you are meeting them for the first time. This is the first time you are meeting them. Okay. So you ask them their name and you ask them their age. Okay. So they tell you their name. This baby's mother, he tells, oh, the name of the baby is Puneet. He is turning 1 year old. Okay. The name of this child, he introduced himself. He says, hi, I am Shiv. I have just started going to school. I'm 5. And then you meet Rakshit, who is 13. You meet Ganesh, who is 23. You meet Ambarish, who is 35. You meet Rajkumar, who is 50. You meet Vishnuvardhan, who is 70. Okay. Now, what you have done is you have actually collected data. Data relating to name and age of people whom you have met. Okay. So, age is expressed as a number, whereas name is text data. Okay. So when you met Vishnuvardhan, the uncle who's 70 years old, Vishnuvardhan is his name. There might be many other Vishnuvardhans, but then 70 is something unique to this particular man. There may be another Vishnuvardhan who's 60 years. There may be another Vishnuvardhan who's just born. Okay. There used to be an actor also in Karnataka. So these are all measurements or observations, each row. So what I have done, I have beautifully entered data in Excel and I took a photo of it and I shared with you. Okay. So in my Excel sheet, see how neatly I have entered? How neat it is when you look at age. There is no YEAR or 1 year, 2 months or 5.5 or 5.5 in English and all. So I have entered data in a particular fashion so that I can easily compute average. I can easily do any statistics with this data. Okay. So I have got information on 2 variables or 2 characteristics that differ between people. So all your column headings in the data sheet that you may have is called a variable. And all these unique numbers are measurements. And each row is called an observation. So once you have this data in a very structured format, it is easy to come up with graphs. It is easy to come up with analysis. Excel itself will have a lot of options to help us do analysis. So this particular training is called data management training, not data analysis, because we need to have some skills to manage our data, to enter our data correctly so that analysis can be done easily. So in the upcoming sessions that we are going to have, we will first see how data is entered. We will make some small changes so that you can quickly come up with graphs, quickly come up with analysis, even without learning anything in statistics. Because Microsoft Excel has a lot of features that will help us quickly learn from data and come up with amazing presentations or reports or even research articles. Okay, so this is the agenda behind the session. We will first learn how to enter data, how to store data, how to come up with graphs from data, how to come up with analysis from data, and how to convert it to a PPT or a Word document in the form of a report, and any other things that you might have during our discussion. Okay, so the only understanding I need you to have is when you fill a form, each question that you are asking, madam, what is your age? What is your highest educational qualification? Where do you live? What is, how are you working? Okay. When was the last time you went for a health checkup? You will ask them a lot of questions. Okay. Have you been screened by TB by any of the government entities? You will have several such questions. Each question is a variable. And each time you get answer from a person, it is an observation. And the answer that they give you, yes, no, I am 46 years, all those become measurements. Okay, so if you have an understanding of what is variable and what is measurement, you are ready to know what is data, and it is going to be easy for us to do data analysis. Now, all of us have data in different forms. Okay, our data is like this. If you see, our data is like this. It's like, it's scattered here, there. So first we need to learn to sort. See, I've put all the blacks together, all the yellows together, all the whites together, all the blues together, all the reds, orange. So sorting is done. After that, we need to arrange. So this process is actually called data management. Okay, data management. And after the data is neatly arranged, sorry, the T went flying, okay, that is T. Okay, after the data is arranged, you come up with graphs, beautiful graphs that Excel provides us with. Okay, we might also come up with mean, median, some summary, way to summarize data. After that, we will learn from data. We will come up with a beautiful learning from the data. And after that, we will talk about it to policymakers, to government officials, to our own study participants. Okay. So here, maybe we will come up with an article, a research article or a newspaper article. Okay. Or maybe we will come up with a PPT, a PowerPoint presentation. Or we might come up with a poster that we will paste. Okay. Might be a poster. It might be a policy brief, might be different things. Okay. It might even be a nice, diagram telling what we have done. Only if you reach here, our data collection will be useful. Otherwise, the whole process of collecting data will not have any impact. So we are here to learn first the management skills, then analysis skills, so that at the end of this particular series of initiative talks, we will be able to come up with a poster or a PowerPoint presentation or a Word document or a policy brief or a research article or a technical report whatever you may deem fit, which was rightly mentioned by one of the participants who wanted to learn to reach here or to upskill to reach here. So this is going to be our journey. And now I'm open to you.
Yes, Dr. Vani, you're done?
Yes.
Thank you, Dr. Vani, for that crystal clear presentation, giving us a very good idea about the basics of data management. So several such sessions, short sessions will be organized as part of this uh, training program. So now for the next 15 minutes or so, I open the floor for Q&A. If you have any questions related to the session that is taken, or what are your expectations on the topics that you really need to know, this is the time for you to express. Feel free to unmute yourself and come in. You can unmute yourself, and it is nice to hear your voices. Please, advance Excel training. Okay. Any other topics that you would like to know as part of this training program? So this training program is not just for quantitative data analysis. We also will be dealing with qualitative data analysis, which I will be taking sessions on that. So yeah. So do you have any needs in qualitative, how to do data analysis? Okay. Max QDA. Max QDA is one tool for qualitative data analysis. There are various other tools which might be easier. Data presentation. Okay. I see people writing in the chat box. Instead, can you unmute and talk, interact with us?
Good morning, ma'am.
Yes.
Yuvraj from Doctors for You. So we have several meetings on a at least monthly basis or a fortnight basis for different platform for different thing. Sometimes we have to present the HR part, maybe how was the notification, number of notification, and the other indicators, and many other things are included. And and me along with our team, that the core team has joined from our cluster coordinator to the data expert, our M&E and admin team, everyone is here. So we do have all kind of data, and the majority of the data is available on it. So if we require some particular data, so that is majorly part are available on it. All we have to download it and have to somehow segregate and add up, and we can present. But still what we have that what is the main reason for all of our team member to join for this beautiful session is to learn the presentation, the art of presentation, the art of adding up the data and how to present it, so that it could be so it can make sense and to the point, so that if we are presenting something that could be comprehensive for the person who are actually attending the session. So we do have our all the data part, we have everything, but somehow we want to learn the art of summarizing the things and making it comprehensive for the person, and so that the presentation skill and how to add up sum up the data part is our main concern and goal, so that it will be various benefit for us, so that with this intervention we can somehow add value to our understanding and knowledge.
Thanks, Yuvraj, for that very important point. I think in our training sessions, we can also include a time slot for you people to present the kind of analysis you have done and get feedback from the experts like Dr. Vani, myself, and other team experts in our network. We would like to bring them later.
Yes, ma'am.
That is also a good opportunity for you to get feedback and then fine tune your analysis, improve your presentation. So yeah, that's a very nice suggestion. We will incorporate that idea in our training program. Thanks, Yuvraj. Any other ideas, suggestions?
Thank you.
So this is not like once in a month we will meet and then we disappear. No, it's like a long-term continuous engagement. For instance, the kind of data Yuvraj has, if he has to analyze, he needs some support. So we will have to meet separately and then, work together to make sense of the data. So that process is also very helpful to gain some insights and gain some competencies with respect to data analysis and management. So that is also very much part of this training and mentoring program. So just want to remind you about this. Any other ideas, thoughts, the topics that you really want to understand? Is there a need for qualitative data analysis? I see that there is some need for quantitative data analysis. Qualitative data, how many of you are dealing with qualitative data? Anybody in the group?
Well, what is this qualitative data in particular? Maybe everyone, someone, us are, we
Yeah.
maybe not, know the terms maybe. So
Yeah. So
if you could
qualitative data is non-numerical in nature. Quantitative is
okay,
numerical in nature. Qualitative is non-numerical in nature. For example, you would have conducted interviews with the different stakeholders, with the patients, family
sure,
members. So that kind of data, how to analyze texts, not
okay,
just text, but also like pictures, symbols, all that will become part of qualitative data. So I'll be taking a session on qualitative data analysis in the coming months. So
sure,
just wanted to understand if you have that kind of data and how to do, because it's not like quantitative data analysis. The approach is very different. There we use inductive approaches, deductive approaches, use theoretical frameworks to understand the data. Maybe after analyzing the data, we'll come up with a theoretical framework. So it's a whole kind of different business we will do with qualitative data analysis. So just wanted to know if any of you have qualitative data, and we can design the sessions accordingly, depending on the group's need.
yes, ma'am, yes, ma'am. We do have the nature of our work that includes qualitative data as well.
Yeah.
A part of very few parts where we have to add up the number of family members and number of tests what we have done. But majority of the part, I guess, that is the qualitative data only, where we have their name, their addresses, their experiences, and that's all related to their treatment part. Okay, so that definitely adds up and will helpful. So yes, ma'am.
Sure.
Sure. Thank you.
Definitely. Thanks, Yuvraj. Yeah, also not just interviews, focus group discussion, but also a pamphlet, document reviews, how to do document reviews related to the topic that you're interested. All that is part of qualitative data analysis. Yeah. Any other questions you have? Expectations you have from this training program? Please feel free to share.
No, ma'am.
Okay, fine. So, Dr. Vani, can we then ask each one of the participants or whoever feels like to share the kind of projects they do and the kind of data they have, so that will help us to better formulate this training program and mentoring program properly. Can we?
Definitely, madam. Definitely. I think that's a nice move because you feel better when you are able to solve your own problem with the help of data analysis tools. The learning experience, I think it'll definitely be better. And as I see, okay, no, I was just reading the chats and I found that the skills required are definitely analysis using Excel. I will also introduce you all to a couple of other freely available softwares which you can use freely for life. And then preparation and summarizing data in the form of PPT. So all these things, it will be very effective if we are able to work live on data that you have collected. Because when you solve a problem, trust me, you will be extremely happy to learn something that you did not know before. And yes, as Dr. Meena rightly has shared, this is just a series. This is not a one talk, and definitely not lecture. Please don't expect me to teach statistics and all. The expectation is you should be able to solve your own problem with support from us at TBPPM as a team housed at IPH Bangalore. So we are there with you in your journey. Through this process, you are definitely going to learn a lot of skills, including advanced Excel analytics. But we will learn by problem solving. So over to you, Dr. Meena.
Thanks, Dr. Vani. Okay, so now let's ask the participants to explain their project, little bit idea about the context where they are working, what kind of projects they are dealing with, and what is their one or two needs. The most prominent needs that you're expecting to meet those needs during this mentoring program.
And also, Meena, like what data set is available with them?
Yeah. If you can share that kind of thoughts on that, it will be very helpful for us to tailor this mentoring and training program. Yeah, of course, after this online session, we will have one-to-one meetings separately, and then we will discuss more about it and see how we can collaborate and what we can do together. Yeah, who would like to go first? Before that, Maithili has a question, Dr. Vani. Maithili, would you like to come in?
Yeah, Meena. As I am working with the CTRIT project, I am collecting data. Means field team is collecting data, quantitative data on different variables. So if I want to develop the questionnaire on particular topic, so what are the variables? How can I choose the variables? That is my big challenge, and I want to know from this workshop.
Okay. Vani, would you like to?
Yes.
I have some thoughts. Maybe after that I will come.
Thank you, Maithili, for this question. I did see it on the chat as well. So the understanding is you are collecting data for a questionnaire developed by somebody else. You are collecting data on it. Correct, Maithili? Could you please be there?
Yes,
Yeah.
Vani.
Now, you would want to develop your own questionnaire. Correct, no? Okay. Maybe for the next study. I'm just saying. Correct, no? Okay. So that opens the door to a whole another new topic called tool development or questionnaire development. Okay. So we need to understand what is it that you're developing a questionnaire for? For example, are you trying to develop a questionnaire to assess stress among your study participants because of financial burden that they have to get their treatment care? Okay. I'm just posting a question here. Are you trying to assess stress? If yes, we need to see the definition of stress. Okay. How is stress assessed by others? So we'll have to review all the other questionnaires that we have and also maybe read a bit about it and then understand what our people need. Okay. There might be questions in the tools developed by others which don't match the Indian setting. Maithili, I think you might have faced that. Our people are not able to answer the questions, some of them. Have you encountered that?
Yes, few questions when I developed the tool, so they may not answer the that particular question.
Okay.
So I faced in during qualitative, not in quantitative.
Okay, not in quantitative, no? Okay. But when we are developing a questionnaire, people whom you are going to give it to, they should be able to understand. So there are some things we call it validity and reliability measures. We have to do that and see if our questionnaire is good enough and then take ahead and meet the people and develop your own questionnaire.
Yeah.
So some steps are there which I think I can talk to you one-on-one, if that is okay.
Also, it's very important to note what is the key concept that you are interested in. Either in the research question or in general in evaluation program, what is the key concept? For example, let's say how a particular intervention is enhancing TB notification. So that intervention is a key concept here. TB notification is another concept which needs to be operationalized in your project. So what are the dimensions to it? For example, in Vani's question, stress was important. Stress is a critical concept. So you need to understand those concepts better by engaging in literature. Maybe there is a physical dimension to stress, there is a social dimension, there is a mental dimension. So what kind of, if you try to understand the theoretical concepts properly, so that will really help you to develop appropriate questions concerning to that particular dimension of the key concept. So that is very important. Okay, I have this idea, then directly I will ask these questions. No, it doesn't work that way. It's really important to critically engage with literature. Sometimes there is not much literature available, so you need to consult stakeholders concerning to that particular topic, because they have their lived experiences and they might come up. For example, policymakers, not much is written about the literature. So in that case, we cannot depend much on literature. So we have to talk to stakeholders, consult them, and then develop these tools. And of course, once the tool is designed, you need to check for validity and reliability. And how you do validity, reliability in quantitative data is very different from how you do validity, reliability. Of course, we don't use the word reliability in qualitative data, but there are a whole set of other procedures which you need to keep in mind to make sure that your tool is very robust. Yeah. Thank you for that question, Maithili. Any other questions
Thank
others
you,
have?
Meena, for clarifying this very clearly. Thank you.
Yeah. So this session is only a teaser. We just want to share what kind of topics we are likely to cover in this training program. Okay, I think I don't see any questions now. We still have 1 hour time. So let's use this time. I request all the participants to share their own projects and their own expectations within the project, what they would like to do using this particular program. What are that 1 or 2 deliverables they would like to have? Who would like to go first? Say, I have this kind of data, we work in this area, this is about this project. So we want support from you on this particular aspect. So these are the things we would like to hear from you.
Hello, Mukesh ji is there on call?
Okay.
Yes, sir. Yes, sir.
सर आप अपने तरफ से जो डेटा हम लोग करते हैं आप उस बारे में पूछ सकते हैं, कोई प्रॉब्लम नहीं है. सो इन द लर्निंग अराउंड हमारी टीम के पास मनीषा है, सौरभ, नीरज, अनूप जी, ये 4-5 लोग. आप लोग इतना सारा प्रेजेंटेशन बनाते हो, इतना सारा डेटा पे काम करते हो. दिस इज द राइट प्लेस टू आस्क फॉर द इम्प्रूवमेंट्स. तो आप लोग आपस में मेक श्योर कि इस सेशन का हम लोग भरपूर यूटिलाइजेशन कर पाए. ठीक है, तो इस तरह से सिर्फ सुनना नहीं है. हाँ, दिस इज द टाइम. तो मुकेश जी आप स्पेसिफिकली एंड अलॉन्ग विथ नीरज सौरभ आप लोग इस चीज़ को पूछिए यहाँ पे. ठीक है, और इसको सीखने के लिए मैंने आपको शेयर किया था. ठीक है, कोई दिक्कत नहीं है.
Okay, sir.
Okay. Yeah, what kind of projects you have, which context you work? Just share that with us.
Hello.
Yes, yes, Anirudh.
Actually, we are working on extrapulmonary TB, EPTB only.
Okay.
Okay. तो जस्ट ये जानना था कि ये एक्स्ट्रापल्मोनरी का जो नोटिफिकेशन है,
Can
कैन
you
यू
talk in English, Dr. Anirudh, so that everybody can understand?
actually I want to know the data analysis of presumptive TB notification to confirm TB notification of extrapulmonary TB.
So you have some data related to presumptive notification and confirmed TB notification, right? So
Right.
can you say a bit more about the project? What is this EPTB project? What do you do in that? Where do you implement this? Some information, some more information on that.
Actually, we are implementing in Rajasthan and Kota district. Implementing, we made a hub and spoke model for EPTB guidance document.
So what do you do? What is this hub and spoke model is about?
It's we made a hub site where diagnosis and consultation is available for EPTB,
Okay.
and spoke site is where the only consultancy is available. The
Mm-hmm.
primary health center.
Okay. And who supports in the transfer of samples from the spoke to the hub?
It's a
What kind of
government.
arrangements you have?
It's a government-supported voluntary incentive scheme where incentive is provided by the government per sample.
Okay. So what kind of data you have collected with respect to this project?
We collected data of the EPTB patients for like presumptive notification and confirm, and other like site of disease, it's lymph node, it's pleural deposit, and genital tuberculosis, and these are.
Okay. So for like, what is the size of the sample? Like how many people's data you have collected so far?
It's around 200 to 300
200 to 300. Okay. Since how many years?
in just last 6 months.
Last 6 months. Now, what is your key question? What is that you are very interested to explore using this data? What
My
kind of
question,
answer you are looking for in this data?
I'm looking for the what is the how to analyze presumptive if the presumptive is 100 and confirm is 20%. So,
Hmm.
so I want to know the how to represent the graphical representation of data presumptive to confirmative question.
Okay. So, okay, I got it. So you want to analyze the data, like from presumptive to how many people from the presumptive stage are actually moving to the confirmation stage, right?
Yeah, right.
And you basically talking about data visualization. How do we
Yeah,
present? How do we present the data, right?
right.
Okay. And what purpose you have? You have any intention to publish using this data, or just you want to present this data to some government authority? What is the
To,
objective of this data analysis?
government authorities to share with them.
To share with them. Okay. So some kind of report you need to submit to the government. Is that so?
Sorry,
Some kind of report you need to submit to the government?
no, some kind of report means.
Means you have this data, so you are expected to present the data analysis to the government. So how do you present? Through PPT or through a report or
Through
uh,
people.
okay, through PPT. Okay, got it. Thank you. So noted your point. So yeah, we can get in touch and then on one-to-one basis we can see what we can do with the data and how to go about it. Yeah. So similarly, other participants, if we can share more about, yeah, I see a hand raise. Who's that? Please feel free to unmute and come.
Ma'am, myself Mukesh from Bihar.
Okay.
Ma'am, we are working in PPSA project and we are notifying all private TB patients who are diagnosed in private doctors clinic. Ma'am, we are facing sometimes problem. Although we are getting all information through Niksha portal, but sometimes what happen when we are segregate this data, we are facing that some data which we have entered their address, blogs, we have entered there, but Panchayat's name is not entered there. Then how can we segregate it? Suppose sometimes government demanding that we have need through Panchayat wise patients list. Then how can we segregate it?
So if I understand correctly, so you get the data through the portal, Nikshay portal. Are you talking about that?
Yes, yes, ma'am.
Okay, some data is missing,
Yeah,
right?
yes.
So in case of missing data, how do you have an opportunity to go back and collect that missing data, Mukesh? Is there a possibility or not possible at this stage?
Ma'am, there have changed some in Nexa portal. In previous, we were getting information through TB unit wise or TB unit residential wise, but now it has been changed. And the option of panchayat is not coming. In previously, it was also not coming, and at present also not coming. So this option is not coming, and we have to add this data. We have to segregate the data panchayat wise and village wise. Then what might be source to collect it? From where we will collect block panchayat wise data and village wise data, and how
Hello.
can be suppose yes sir, yes sir.
Okay, sure. Ma'am, let me paraphrase the question for you. So, what is happening that the TB unit from Bihar, like the STO office in Bihar, they are now focusing to uh, like on a decentralizing this all effort of the TB elimination, and they are starting the drive of TB Mukt Panchayat in Bihar. And to process it further, so they have asked us to fetch out the data of the patients on the criteria of panchayat wise. So suppose if in one district there are like 1,000 patients, so they are asking us to segregate the data on panchayat basis. Yes, Mukesh ji, this is the thing.
Yes sir, yes sir.
Okay. And since while we notify the patient, so we ask for the basic details where we ask them for their address, their home, and everything. We are putting the data on Niche, but we were not prepared for this. We were not prepared that one day a government will ask us the data on the panchayat basis. So we just had this block at their village and basic details. Okay. So now when they are asking us to prepare the data on panchayat basis for the entire year, we are now getting difficulties to segregate the data since we have not added it in the same way as the government asking us to do. So yes, we can like in one district there might be like 20 blocks or 10 blocks. So we have uh, put it the data in that way, in such a way where we can segregate and we can fetch the data of the patient on a block basis, because we have we are very much familiar with the TV unit or the blocks. So we knew that there would be days when we might ask to segregate the data on the block level. So we were prepared for that. But we are not prepared for this panchayat level or the village level, since this is a very good initiative from the state, considering they can have this TB Mukt Gaon or TB Mukt Panchayat initiative, and this is the very nice way to at least have an understanding that where the key population is there or are there, or where this TB notification have coming, on a higher note. So they have a very good initiative, but we were not prepared for this. We have been working in PPSA for like 3 years, 4 years, 5 years now, and suddenly just 2 days earlier they have asked us to prepare and said share their data on panchayat level or village level. So since we do not have this mechanism, how we can do it, and how and there are challenges, like there are further there are many challenges, like similar challenges where we have been asked to share data. And since you were asking that what is the mode of our data, well, is some PPT, or is it a Word file, or this Excel part? So as a PPSA agency, we have of course we have majority of the data that has to do with the Excel part, since we are downloading it from the niche and we are segregating it. But it's one of the parts. The Excel sheet is one of the part where when we are only talking about the data and its complexity, we are sharing it on Excel sheet. But in review meetings, in 6 months we have a review meeting in every 3 months, or where we are showcasing our work. So that also requires the major PPT where we are sharing the quantity data. And it's not only limited to the PPT, so to the Excel part, where we are also have to showcase our case study, where we have to show that how our modus operandi is there, and how what is the many other things that is related to our implementation part. So in that area we have to share this PPT. But as far as data is concerned, where WHO consultants and many other stakeholders are there, we have to share the data on Excel. So we also need to have understanding that how these both are different from each other and is still very much similar, where it needs to share a comprehensive data with each other. So yes, this is very important part our team needs to learn. And somehow they this very for the very first part, my team has been a part of this kind of intervention where they have to have a opportunity to interact with each other and other stakeholders. So for the very first time, they might have no this kind of they may take some time to understand and everything, but they are very hardworking. They are very expert to their field, and they wants to understand it. Yes, so I'm here. I'll be part of their their learning part. But yes, ma'am, not only this panchayat part I shared with you, but a part of this Excel sheet and the difference between Excel sheet and the PowerPoint presentation, maybe Word file, is all very much will be helpful for us, ma'am. Thank you.
Yeah, I see a message from Dr. Vani. Thank you for sharing that elaboratively. So we understand it better now. Of course, these are very practical issues. How do we sort out? Yeah, so I see the real need for how to maximize the utilization of Excel. Maybe some training on basics of Excel, even advanced methods that you can use in Excel. So that would be very helpful, I feel, for you. Now that government programs are always like that, no? Suddenly they will introduce something new and then you'll have to manage. So I feel usually the Nikshay portal, the patient address is entered, right? Complete address of the patient with phone number
Yes,
actually.
yes, sir. Yes, ma'am.
Yes.
Yeah, so if that is a possibility, then by looking into that address, if we can cross check and then identify which gram panchayat they belong to, maybe that is feasible. Is that feasible, or you have like more TB patients and this is quite unmanageable to do? What do you think?
Some in some addresses panchayats are written, but generally we are writing name of patients, their village name, and pin code, landmark. These are the data are entered there.
Yeah, using that village name, using that landmark, if you can identify which gram panchayat they belong to, I know it is a Herculean task, but I assume you will not have many TB patients, right? Maybe in thousands you have?
Yeah, more than
Like
1,000, ma'am. 5,000 minimum yearly.
10,000 yearly.
5,000, 5,000.
Okay.
On a district basis, ma'am, on a district basis.
Basic
In
base.
Bihar, in 2024, we had a target of 60,000 patients to achieve in private notification, and somehow we were completed like 55,000 in 1 year. So it's around 95%. So a 55,000 patient in 12 districts. So we had 12 districts in 2024.
Yeah.
And now from very beginning of this 2025, we have been added another 10 districts. So 12 and 10, so 22 districts in Bihar. So we know that, and our overall target has been doubled. So like it's 110,000 patients in a year we have to find in Bihar. I know it's a very big number. We have a big team, and we have very good reputation with the doctors. We have been working in Bihar for like 5 years, and considering this new responsibility in Bihar, so we all are very much aware about how data is important, and how data will have to play their vital role in the in presentation our part, and to learn, and everyone can ask us that how you are working in 22 district, you are saying those all big numbers, let show me. And when they say show me, somehow we are not prepared for it. Of course we are doing it somehow, but we want to make it more professional, we want to make it more organized, and we are very much hopeful that these sessions will help us.
Definitely.
So yes, ma'am. That is the part. Yes.
Yeah. So I think we need to sit together separately and see what kind of data you have and then the kind of problems you are facing. Of course, you, me, and then Vani, Dr. Vani, of course, and then see how we can solve some of these practical issues with the data. Yes,
Yes,
Dr.
ma'am.
Vani,
Sure.
you have anything to ask these participants about what has been shared?
We had a hand raise from Neeraj Kumar in between, so I would like to hear Neeraj as well.
Yes,
Okay.
yes, ma'am. My question is na presentation. So charts and bar with var, including part of analysis data, which month increasing up and down. So kindly present matlab, training session is so clearly for senior person, public health, state health society meetings attend. So
एक बार हिंदी में बोलो
presentation.
नीरज, क्या एक्चुअली में कहना चाह रहे हो?
सर बोलना चाह रहे हैं सर कि जैसे मीटिंग में हम लोग जो जाते हैं तो मंथ वाइज का जो प्रिपेयर चार्ट रहता है तो चार्ट विथ बार जो मतलब कि रहता है
ओके,
इंडिकेट करने का
पाई
कि एक
चार्ट
मंथ
हो
में।
गया या फिर बार।
जी।
ओके ओके ओके
यस
ओके
यस सर।
ओके।
Hmm. Okay, I see there's a clear need for data visualization, a session on data visualization, when to use bar, when to use pie chart. Yeah,
यस मैम।
so graphical presentation of data, these are some of the critical topics. And Excel, how to use Excel, what are the different techniques within Excel that can be leveraged for our kind of work. Yeah. Yes, Dr. Vani?
So data visualization, as you rightly pointed out, and maybe sorting and filtering and developing tables, sub tables from data, because that is one thing that I felt when I was listening to both Anirudh ji and Yuvraj ji. I felt that but what we need is we would need some data from your end, or maybe of completed projects, so that you will be able to do by yourself for your current projects. Any because if we bring in data, it will not be aligned to your project. It will not be very clear. Dr. Meena, what do you think?
Yeah, I think for the next session, we can teach about data visualization, something like that, for maybe half an hour, 45 minutes, the very theory part of it. And then in the meantime, we can contact your or other participants who spoke to us today and then work with them, the TBPPM Learning Network. We will work with them and then make them to do a small presentation. During that session, and then we give feedback and we also learn from that process. What do you suggest? Do you think it's a good idea? Like
We
we will
can
have a
focus
short
on
session, theoretical
yeah,
session on data visualization.
visualization.
And after that, we will ask Yuvraj or somebody from the team to present what they have, what they've
Yep.
analyzed.
Yes.
Then we use that opportunity to give feedback and then
Sure, ma'am. That
yeah.
would be very much helpful for us as
Yeah,
well.
you can also get peer feedback from
Sure,
others.
sure,
So
ma'am.
whether using concrete examples from your end, we can learn, I think, from live examples. And but in between, to develop that kind of presentation, maybe we should sit together one on one and then discuss what is useful. Maybe it's not within that 15 minutes presentation, you cannot present the whole project, parts of the project. Yeah, I think we can do that after this meeting.
Definitely. That seems to be a good idea.
Okay. Okay. Anybody else would like to come in? We heard from Anirudh, Yuvraj, Mukesh. Others? What kind of projects you're implementing? Would you like to share? Anybody else would like to come in?
Sorry, ma'am. Our team has already shared the problem we are facing currently. So in the next session, we are eager to learn about the data visualization and data sorting part. Thank you.
Sure, sure. Okay. Okay. I think we have come to the end of the session, Dr. Vani. For the next session, the need that is expressed by the group is data visualization. Yeah. So we'll organize a session in February. We will let you know the dates and all that. And you also do some analysis and try to do a small presentation during the session so that you can get feedback from others. Yeah. So looking forward to working with you all, and we'll see how our partnership emerges and what kind of products we can develop together. That is something really helpful for the society as well and for the National TB Elimination Program. Yes, Dr. Vani?
What we could do is before we start the next session, maybe one or two teams can present their idea of what they have done. Okay. And then we can go ahead with the session that I intend to take. And after the session, maybe another two teams can present. And when they present, they can tell if they have gone wrong somewhere or if, what corrections they can do. So that way you get to know before and after. So we will have some presentations before also and some presentations after.
Yeah, that sounds great. So who would like to present in the next meeting? Let's say February 2nd week. Vani, how is that?
I think third week would be perfect.
Okay.
Just a minute. Just a minute. Maybe to 23, 20, one second. I'll just tell you. The week between 23 and 28. 23 is a Sunday, I know, but then 24 to 28, that week, 24 to 28, the last week actually would be perfect.
Last week of February. Yeah.
Yes. And if we are going anytime before that, the concern is I have classes, so post 5 would be okay if it is any other day.
Yeah. Okay, post 5. Okay. Participants, you have any concerns? Will that work if you organize some sessions after 5? Will you be able to join?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am, definitely.
Yes, ma'am.
Okay, sure. So we'll see, but the session will happen in February. If it is other weeks, then it's going to be after 5 o'clock in the evening. If it is last week, then somewhere this time we will plan with Dr. Vani. Fine. So that is done. But Dr. Vani is suggesting uh, at least 4 people to come forward and present their data with a larger group. Who would like to do? I see multiple hand raises. Please feel free to unmute and come in. Yeah, Karan? Karan, you have raised your hand. Would you like to say something? Karan, can you hear us? Okay, maybe some network issue. So,
We could also break it into 2 sessions if that is okay. If it is post 5, we could break it into 2 so that it's not too long and not crossing
yeah,
7 and all.
exactly.
So maybe 5:30 to 6:30 on 2 occasions should be fine. And any one-on-one meetings, we could do it before that after 5 with any team.
Definitely. So, Yuvraj, would you like to present in the next meeting in the February session?
Okay, ma'am. Okay, ma'am. Sure, sure. We will present our side of the
So you don't
PPT.
have much time. You'll be given 10 minutes time for your
Okay,
presentation.
sure.
A little bit about the context for the data and then what data you have, what kind of analysis you did. That's it.
Great. Okay, ma'am. So understood the point. So I'll just paraphrase it that the kind of data we usually present, that will be there, and what kind of improvement we are expecting to have it in and want to learn. So this is what you are asking.
Actually, like the data you have and the kind of analysis you have done,
Mm-hmm.
a little bit about what problems you faced with that data.
Okay, perfect. Okay, madam. Okay, madam.
And then Dr. Vani will talk about data visualization.
Mm.
And then after that, you will be able to compare like where you went wrong, how it could have been done better.
Okay.
Yeah. After Vani's presentation, also we expect some participants to present so that it is an opportunity to compare and contrast and that learn from that process. So before Vani starts, Yuvraj, your team will present for 10 minutes, right?
Okay, ma'am. Yes, ma'am. Sure.
Any particular part of the data you present, like, it's really not possible to cover the entire project in 10 minutes.
So I'll present a PPT of approximately 15
Okay.
page of PPT. So that will cover in 10 minutes, and I'll make it comparable to all the works we do on usually, and so we won't make it long. So we could make it short, and we'll focus on the very key interventions where we can have this improvement of space for improvement maybe.
Where there is potential for
Okay, yes, ma'am.
analyzing the data, visualizing the data. So that aspect of the project you focus more.
Okay, ma'am. Sure. Sure.
Thanks, Yuvraj.
Thank you.
Any other teams, participants, would you like to present your project and data during the session? Anirudh, would you like to present your EPTB project data and get inputs from the team? Anirudh, are you there?
Okay, I will try.
So for time being, we have two participants who have come forward to present their project and data. Yeah, I think that's a good number. Yes, Vani? Somebody has raised hand. Who's that?
Yes,
Karan, okay, sure. Any other points? Anything did we miss, Dr. Vani?
I think we are good to go and we have a clear-cut plan for our next interaction.
Yeah.
It's a thumbs up as I see it.
Great. Nice. So thank you, everyone. This was a productive meeting. We could understand better your needs and what really you want from this program. So this our partnership will evolve based on our continuous interaction. So I'm really looking forward to working with all of you, myself, Dr. Vani and Mohana. Please stay in touch. Please write your concerns over email. Feel free to reach out to us if you have any concerns and things that you would like to share. Have a great day. Thank you very much. And we will keep you posted about the next session. We will inform you much early because you need to prepare for your presentation as well. But the session will happen in the month of February. If it is first, second, or third week, it's going to be after 5 o'clock. If not, last week of February, it's going to be sometime around this time. Yeah, all good? Okay, thank you very much.